Hey guys, so I'm going to present to you my article. It is entitled Social Communicative Effects of the Picture Exchange Communication System in Autism Spectrum Disorders. Again, that's also known as PECS. This was published in 2012 in the International Journal of Language and Communication Disorders. It was conducted by Anna Lerner and others. So a review of the relevant data. So many of us know the core characteristics of autism spectrum disorders appearing early in life are communication and social interaction impairments. Historically, these were treated by verbal production through response training. However, the PEC system is a popular treatment approach for children that are nonverbal, and the approach does not rely on verbal production for communication. PECS is thought to facilitate functional communication, improve severe impairments of functional speech, and decrease problem behaviors. Unfortunately, at the time when the researchers wanted to do this study, there was little empirical evidence that has been conducted and is available on the usefulness of PECS. So obviously, with the demand for evidence-based practice, this is a problem. So the statement of the current study or problem. So the group wanted to conduct research to determine the effectiveness of PECS through stage 4. There's 6 stages of PECS with children with autism spectrum disorders to contribute to the limited literature currently available. So Learn and others cite that only 3 group studies were available that demonstrate positive effects within the social domain for children diagnosed with autism spectrum disorders. In addition, only one of these studies includes systematic standardized assessments. The other 2 just utilized unstructured observation ratings. Therefore, so this group wanted to utilize standard and unstructured measures to determine outcomes of PECS of children diagnosed with autism spectrum disorders. So the specific research question, the researchers intended to test the effects of PECS on social communicative skills in children with autism spectrum disorders while simultaneously considering standardized psychometric data, standardized functional assessment of adaptive behavior, and information on social communicative variables coded in unstructured setting compared to conventional language therapy, also known as CLT. So moving on to the methods, 18 preschool children were assigned to 2 intervention approaches, PECS, going from stage 1 to stage 4, and then again conventional language therapy. The participants were all recruited through the Eugenio Medea Scientific Institute in Italy. For inclusion in the study, each child had to meet the following criteria. First, they had to have a diagnosis of an autism spectrum disorder made by a psychiatrist in accordance with the DSM-4. They have to be between 18 and 60 months of age. They have to have little or no functional language, so they determine that by spontaneous use of less than 5 words. They had to not currently be using PECS or any other augmentative communication system, and they have to have no evidence of severe sensory motor or known comorbid conditions. 30 children were screened and 18 met the inclusion criteria. Treatment groups were determined by where the family lived in relation to the clinics that the treatment would be given. All children were from southern Italy, and the group consisted of only 1 female. Each group was given therapy 3 times a week for 30-minute sessions over 6 months. The percentage of correct requests per session per criterion was measured for each of the 4 PECS phases. Before proceeding to the next phase, in accordance with the manual, 80% accuracy had to be met over 3 sessions. Outcome measures included the Autism Diagnostic Observation Schedule domain scores for communication and reciprocal social interaction, language and personal social subscales of the Griffiths Mental Developmental Scales, communication and social abilities domains of the Vineland Adaptive Behavior Scale, and several social communicative variables coded in an unstructured setting. Evaluations were carried out at different locations from where therapy was carried out. Assignment was based on distance to the treatment center. Children within 50 miles of the Eugenio Medea Center, I'm not Italian, were assigned to the PECS group. Children living greater than 50 miles were assigned to the control group. The control group received the conventional language therapy training at an accredited center close to their home. So, reviewing the results, the two groups did not differ at the pretreatment assessment, but did significantly differ statistically at the post-test. The PECS group showed a significant improvement with respect to the conventional language therapy group on the VABS, again, that's the Vineland Adaptive Behavior Scale, social domain score in all domains other than eye contact, which we would expect for someone on the autism spectrum. But they did improve in regards to joint attention, request, initiation, and cooperative play. So overall, I thought this article is well organized, well written, and pretty easy to follow, very straightforward. All diagrams are easily interpreted and significant to the overall understanding. This article I felt was appropriate and did contribute to my overall knowledge of pediatric communication disorders, specifically with using PECS for clients diagnosed on the spectrum disorder. Sorry, on the autism spectrum disorder. So the most significant criticism I had was in regard to the characteristics of the population and the assignment. While learning others' inclusion criteria, I did appreciate it and I thought it was appropriate. I think having only 18 participants made it very hard to generalize in regards to, larger populations. In addition, although we've learned autism spectrum disorders are more common in males, it would seem to me that there would be more resilient findings to include more than one female in the study, because basically all results regarding females depended on her developments with these treatments. Also, a big problem I had was that participants were not randomly assigned. This, of course, creates many extraneous variables, and I thought it would also have been beneficial to have children from various countries to demonstrate that the effects are cross-cultural. Perhaps the study can serve as a pilot for future studies around the world. Obviously, more research is needed in this area. Lastly, because the study was carried out in Italy, one has to take into consideration the differences across cultures between Italy and America. Appropriate communication behaviors and social interactions, I would assume, are likely very different between the countries, so an SLP would need to, consider that when trying to use this article to support their use of PECS. Lastly, some clinical implications for future research, assessment, and treatment. I think it was excellent that they demonstrated the effectiveness of PECS, certainly with their group. They had statistical measures and they had some unstructured, behavioral observation to measure their outcomes, and I think that was very strong. I think this study certainly contributes to ASH's desire for us to use evidence-based practice, but I think more research is clearly needed across cultures. And that's about all I have for you guys. Hope you learned some interesting things about PECS. Thanks.